3:15 Eastern Time. And with me, I am joined by Dr. Hari Naidu at Westchester Medical Center, who is also at home right now. And Hari, thanks for spending some time with us today.
You're welcome. My pleasure. I think these are very important, and everybody gets a glimpse in how people are at home.
I know, isn't it funny? Even on CNN this morning, there was, all these interviews, and everybody's houses are in the background. No fake backgrounds, no New York City skyline. Just kind of strange how all of this is becoming normal so quickly.
I know. That's true. It's okay. It's a glimpse in the life of people, and you can see we're all human. We're all doing the same stuff as we go from work to home.
And we're all trying to stay safe and make the community safe.
Right.
So I'm going to kind of just banter here with you for a few minutes while people find the live stream and they start joining us, so that we don't have to repeat ourselves when they say, what did you say about X, Y, and Z?
Sure.
So they'll join in. And this morning we had a conversation with Dr. Eric Adler at UCSD, who talked a little bit more about specifically what is COVID, what does it do in terms of HCM, DCM, and transplant patients, and what they should be looking out for. Today, we're going to focus our discussion with Dr. Naidu on how to stay fit at home. We'll go into some basics on COVID and HCM, but if you want to see more on that, go watch the other video, and then we're going to kind of continue the conversation. And we'll be continuing the conversation at least over the next week or so with the content we've already got set up for you. So, Hari, you're in New York. You're epicenter.
We are.
What's going on, and what should HCM patients be very aware of from your country right now?
So I think it took us all, as you know, by storm. And obviously, New York is the epicenter right now. Thousands of cases. All the hospitals are getting flooded by this. It is something we've never seen before. But I think the hospitals are really doing a great job of addressing this. So at the hospitals I've seen in the New York area, they're basically preparing to make sure that there's enough beds for patients, preparing to understand how to treat these patients. Yes, there are some treatments that might come down the pipeline, some you've heard of, some that are hopefully coming in the next month or two. But really right now, it's about social distancing is one big thing. And that involves things at the hospital, but also, as we see on the news, to everybody else in the community. And hospitals are really preparing by, as most of the patients here know, by essentially closing most of the outpatient offices, except for televisits and urgent visits. So at Westchester Medical Center, we, of course, are still seeing our patients if it's urgent. So, for example, if a patient is started on Norpace and they need an EKG, we will still do that. And we have NPs and different people in the office who can do that and communicate with us. My whole team, as you know, we have two coordinators, an NP and myself, and Dr. Panza and several other clinicians. We're available and communicating all the time about all of our patients. We are fortunate that we've done a lot of this by email with our patients and by texting with our patients all these years. So they're very used to getting one person, Mallory, as you know, and she distributes what needs to be done to the rest of the team, and we get back to every patient on the same day. So I think we're trying to create a situation, and I think most centers are, where patients don't feel lost. I think we've done so much of this online or by phone for many, many years. And the only difference here is patients need to know if they get more sick, where can they go? How can they be handled? And everything's open. It's not like things are really not closed. It's open and available. So there shouldn't be any fear and panic about that, especially those of you at HCM centers. We know how to treat you. We've been doing it for many years. We can understand everything you're going through, and we can assess a lot of these things while you're at home, including doing blood checks, weight checks, blood pressure checks, and reassessing you and making sure that you stay safe over these next few months without the need to end up in the hospital. So that's our biggest concern, is that if we're not able to physically see people as much, how do we make sure that they're treated well and stay fit and healthy for the next few months so that we can go back to business as usual in a few months?
I think that's all fantastic. And just so everybody knows, you're in the middle of Manhattan, and that's what we're hearing in the background.
Yes, you can hear ambulance.
If that were outside of my house in rural Jersey, that would be a little bit different. But you're
exactly.
It's just background noise to you.
For me, it is. I don't notice it. I always tell everybody it's very quiet in Manhattan because I don't hear any of it.
Yeah, no, not exactly quiet. So what we want to focus on today is, and we'll take some questions later from anybody who has them. We can't answer, specific questions about a patient, their individual profile, but if you have general questions, we're happy to address those. So I have a little agenda for us today, and we want to talk about, how do you stay fit? So the first idea is to maintain a schedule. And you probably, if you've watched anything on TV about how to live through a pandemic or how to live closed in, the first thing is to maintain a schedule. And I talked about this briefly in the last talk with Dr. Adler. When I went from HCM to a pre-transplant patient, I basically was going through the same things that we're all going through right now. My world got very small. I had to stay at home. I didn't have a lot of social activities. I was very isolated. And the first thing that I found was critical was to be as normal as possible. And by that, I meant getting up the same time every day, going through a morning routine, having your breakfast, getting dressed, doing your makeup, doing your hair, whatever your morning thing is, do it. Although I'm very depressed right now, my Nespresso machine has died. So I have to do this with not real caffeine in the
Yeah,
morning.
we can tell, Lisa.
It's been very stressful. It's been very stressful, but keep that routine. Eat at the same times and go to sleep at the same time. And I was hoping that Dr. Naidu would talk a little bit about why a consistent sleep pattern is really important.
Well, I think all of these things are important because you can't just abruptly go from your day-to-day routine to something like this without totally losing your mind, right? I mean, you'll get people, there's a big fear that people get more depressed. They'll follow up their routine, both in terms of, the amount of steps they take in a day, how much activity they do in a day, and what they eat in a day. People tend to stress eat. They also tend to eat unhealthy during this time. Remember, if we all went out and brought food back that will last a couple months, well, what kind of food is that? That's processed food, that's frozen food. All those foods have a lot of salt in them. So you have to really be conscious of what your eating routine has been over the last year and try to stick very similar to that, both in terms of the calorie content, the composition, but also very much in terms of the amount of fluid you drink and the amount of salt you're taking in. And sometimes it's very hard because you don't know. And so maybe adding in things like a daily weight check so that you can tell your physician, your HCM specialist, that if your weight goes up more than 2 or 3 pounds, there may be an issue there. Many patients with HCM tend to have congestion, especially if they're older. And so obviously, if you're on any diuretic, that could be hydrochlorothiazide, diazide, Lasix, furosemide, any of those pills, you're the kind of person that is prone to filling up with fluid and salt, and you should be checking your weight every day during this time. Back when we were able to see you routinely, we would catch that. But since we don't see you as much right now, those are the triggers that would help us assess whether you're getting worse and avoiding a hospitalization, which you can easily prevent if we do things properly. But the routine is helpful because if you don't get on a routine, you start falling into a situation where you don't know where the day of the week is anymore. Days fall into weeks fall into months, and you can get very depressed. You move from the social isolation that's healthy right now to prevent infection and spread of the virus to a social isolation that could be very depressing and anxiety provoking. And you're already living with some chronic disease, some more than others, and so you don't want to add that to the situation. So if you get up at the same time every day, you take care of yourself, you find an agenda for the day, it's going to be different. It won't be the going to work agenda. It'll be doing some other type of work during the day where you mix in some happy things and fun things like movies and whatever frees your mind to other things that are necessary for you. Maybe you are working from home and some of that stuff has to get done. And that'll also allow you to ride this out for as long as possible until things go back to normal.
So in terms of, we're going to talk about two things, sleep patterns and salt. But sleep patterns first. There is cardiologic benefit to a good sleep pattern. Having the circadian rhythm follow the same thing all the time so that our bodies are used to functioning in a certain way and we're not jarring our normal to some abnormal functioning. Can you talk a little bit about that?
Yeah, I think everybody knows, and if they do this, that especially as you get older, you need to have a very, very strong sleep routine. And I would recommend, all these apps have, they give you an idea of when you've typically gone to sleep and when you typically get up, and I would stick to those things. There's no question that there's a lot going on in the human body while you're asleep. There's a lot of regeneration or recovery of function, mental function, but also physical function. It's no question. It's no surprise that if you don't get good sleep, you're more prone to infection and more prone to catching these. I'm sure it'll be shown. So whatever your routine is, if it's 6 hours, 7 hours, 8 hours, most people get 8 hours a night. That's probably ideal, 7 to 8 hours. Whatever the routine is, you should try to get that number. And the number is part of the problem, but also the general time you go to bed and time to wake up, that shouldn't change during this. So if you typically go to bed at 10 p.m. and get up at 6 a.m., you should try to follow that all throughout the time when you're at home. Don't think of it that, oh, I'm at home, I don't have to get up in the morning, so I should change my routine. Well, that is jarring for the body, and there's no question that that will change things. Things happen at night. Your cortisol spikes in the morning. There's other hormones that change by night versus daytime. And if you change that up, it's going to impact your metabolism the next day. And so you want to keep that very stable.
Okay, so that's digging into sleep a little bit more. Now I want to dig into what you talked on briefly. We are doing a lot of, everybody went shopping and everybody bought a lot of food, and most of that's probably frozen food or things you're going to have to bring back to life food wise, because it's been frozen for a long time and it's going to start tasting nasty. So you're going to put a lot of seasoning in it,
Right.
Or you've got prepared foods that you're bestowing away. Salt, Sugar, and Fat. Great book by my friend Michael Moss, by the way. But why are these types of foods probably not great for those with HCM?
Well, there's a lot of reasons. Obviously, let's just talk about weight in general. If you start gaining weight with HCM, it results in a variety of problems. One is that if you gain weight, then you're already struggling hard to variable degrees in each person, has to work harder, has to pull a larger amount of a load, so to speak. I tell patients that sometimes they have some mild heart dysfunction. Their HCM can be just mild, but if they put that same mildly dysfunctional heart in a much larger individual, it'll struggle. And so one of the things that patients can do is maintain obviously the ideal body weight, but I even ask my patients if they're overweight, just lose 10, 15 pounds. It makes a huge difference in terms of the work that the heart has to do. So number one is that you don't want to be gaining weight during this time. And you should actually try to lose weight. Obviously, that's hard in general, even harder during this time when there's a lot more stress. The stress is also going to cause you to gain more weight. So stress releases cortisol, which is a steroid, and steroid causes you to gain weight in areas that you don't want to gain weight. And I know, Lisa, you were on prednisone at one point, and people who've known Lisa for a while, she went through that with transplant. And it's the same kind of steroids that do that to your body. So stress results in higher steroid levels in your body, which results in obesity, more central obesity. And so during this stressful time, you couple that with poor eating habits, and you will undoubtedly gain weight. The other thing is when people are at home not doing anything, one of the activities is eating, because it's right there. When you're working, food is not always available. You're working and you get distracted and you don't eat. So I'm concerned that my patients may be at home and have nothing to do, so they eat more and they're not active. And people forget that the vast majority of what you use in terms of your caloric utilization is your basal metabolic rate, and just the typical things you do in the course of the day. From you'd be surprised, I think Lisa already knows this, that you walk around a lot during the day, and if you're at home, there's obviously not as many places to walk. So obesity does that. The other thing that's specific to HCM is that I have found, especially in obstructive patients, if you're more obese and you gain more weight, you end up causing a lot more changes in your breathing that result in a lot of changes in the amount of blood that comes back to the heart. And then the obstruction can get worse. So patients who gain more weight end up having a lot more obstructive heart failure symptoms earlier, and which is why in normal times I advise people to lose weight, not just so they look better and fit in better clothes, and obviously obesity results in diabetes and high blood pressure and everything, but a lot of the heart failure symptoms may go away. And I have found that patients who are on the cusp of needing myectomy or alcohol ablation, if they lose 20 pounds, that could be avoided for several years in some cases. And so that's the other reason that trying to maintain weight is important. Now, the salt we can talk about, because salt also gains weight, but that's fluid weight. So when you eat too much salt, if you don't have a normal heart, the heart doesn't push that out, and it tends to retain fluid in the kidneys. And so you then get edema, so swelling in the legs, or you may get more congestion in the lungs, and that causes more shortness of breath. So I would recommend, as I mentioned, obviously try to cook at home if you can without salt. But obviously in these times where a lot of it's processed, if you have to eat it, you eat it, and then you basically watch your weight. And if your weight is going up, this may be a time where what we call subclinical heart failure, where you didn't have swelling before. Now with this kind of eating, you may develop swelling in the legs. You may develop some shortness of breath, and if you gain weight, it may be the one time where you need a little diuretic, and that's where you'd have to talk to your physician and tell them, I've been gaining a little bit of weight. Yes, I've been eating this. You have to equate it to like if you go on a cruise ship, or you're going away for an all-inclusive food at Club Med or one of those places. Typically, you eat a lot and you eat very processed, salty foods, and people come back in heart failure, not uncommonly. And so this is like a mini vacation here, where you're at home and eating all the wrong stuff. And so as long as you're conscientious about it and understand that this might happen, you can then weigh yourself, and then you can tell your physicians, your eating specialist, if that's happening.
So I'm going to turn that on its head, and I'm going to put it out there as a challenge for everybody. I just posted a link to the Food Network, one of my favorite channels, healthy recipes link. Instead of being home eating foods that aren't so good for us, why don't we take a challenge and say, now you have the time to prepare a meal and cook it sensibly and use the ingredients that are good for you. Stay away from the salt, sugar, and fat. Stay away from the empty carbs. And look up a couple of recipes and challenge yourself. I don't care who you are. You can follow a recipe. And yes, it might be difficult to get some of the things into the house in terms of what's available in the stores right now. But I will challenge almost anybody anywhere in America. You can go to your food store and you can get decent quality food right now. We're not having a food shortage. I heard a great thing from the grocers organization. They were preparing for Passover, Easter, and one other holiday that they were saying that they were bulking up because families are going to be together. So there's tons of food out there. Don't worry about that. Don't try to eat processed garbage because you think that's all you have options for. Go to the healthy recipes, challenge yourself. And if you're in our HCM community, in our closed group, take a picture of your healthy meal and post it.
Right.
We can have some fun with this.
The other thing is, say you can't get as much fresh vegetables right now. You can get frozen vegetables, and you can get frozen type things, and none of that has salt in it. It's really the canned soups and the processed TV dinners, if they have those anymore, that kind of meals.
They do.
Those things all have a lot of salt in them, but kind of the ready-made, already done. But if you still get the ingredients that are frozen, you can thaw those and make those into meals and just avoid the salt. The other thing I want to mention is the water. There's a lot of discussion about when you're sick, obviously drink a lot of water. Remember, if you're on a diuretic of any type, and I mentioned them earlier, you're prone to retaining water, especially with the salt. So I would recommend, yes, you should drink fluid. That's normal for you, whatever you've been drinking normally. But don't overdo it. And if you overdo it, make sure you're checking that you're not getting more short of breath or getting any swelling. And I oftentimes teach my patients how to check for edema by showing them to push over the bone at their ankle, the ankle bone. And if they push for a few seconds and they let go and they leave like a crater like the moon, that means you have accumulated fluid. And that's enough for me to, if I teach you that and you know that and you tell me you have that, I can adjust your medications, and then we can send you to get some blood check in a couple of days to make sure that we're, on the right dose of that. So.
That's fantastic. So we have a lot of comments kicking in here, and I'll pause from our agenda items to address some questions because I don't want them to get too far into the feed here. First question is a COVID-y related question. I work as a healthcare assistant. She says, I have cardiomyopathy. I'm assuming hypertrophic. Should I be at work at this time with the risk of catching the virus?
Yeah. So our patients have been calling for weeks now, and I think, and you and I talked about this, Lisa, as well. There's two things. Nobody should want to catch the virus. There are young people with no heart disease, no any problems, who can be very sick with this, and we're still trying to figure out why some people are sicker and some people not. There's some data that's related to blood type, some data related to genetics and receptors in the lung, and I think all that's going to come out when the dust settles. But there's no question that nobody wants it. It's true that the majority of people may be asymptomatic or minimally symptomatic, but the ones who are sick, and they can be 20-year-olds to 80-year-olds, they can be very sick. And I actually have friends who are physicians who are fighting this, and they're previously healthy, including marathon runners. So nobody wants this. That being said, we have to make some judgment. If in an ideal world, nobody should be out. And we can talk for a second about social isolation, social distancing rather, because what we're talking about here is not necessarily protecting the person that's staying at home, although it does that, but giving the virus no place to go. Social distancing works because if everybody's far apart from each other, the virus over a course of 2 weeks will die because it has nowhere to go before it dies. It doesn't jump to anybody. And so that's why social distancing works. And that's why when you see kids on the beach in Florida and other places, it just causes the disease to last longer in society because it's going between them and living for a while. And then we can never stop this thing. We can never stop our social distancing because it's still alive and kicking. We need everybody away. If everybody in this planet was 6 feet away from everybody else for 2 weeks, and we did that right away, like right now, if we could do that, this thing would be dead in 2 weeks, period. But that doesn't work because people don't follow the rules. Now, that's how social distancing works. It is true, though, that if you stay in your apartment and you don't see anybody, of course, you can't get it either because you're not seeing anybody, so it can never jump to you. So what follows from that is that you could potentially protect yourself from it by distancing yourself. So if you are going out, you should probably, and you're susceptible to this, you should get, and everybody is, but some are more than others, and we'll get to that in a second, you can wear a mask and you can avoid people who are coughing. And the other tricky part, however, is you should also never touch your face with your hands until you come home and wash your hands, because there's 2 ways people get this. One is you're breathing in what people coughed at you or sneezed at you. And so if you're 6 feet away, that's not going to happen. And if you wear a mask, that won't happen. But the other way is that apparently this virus can live on the doorknobs and other places for 1 to 3 days, depending on the material. And so go ahead and touch it. That's fine, or clean it off. But then when you get home, wash your hands right away. And anything that touched anything out there, wash it right away. It does go away right away with soap and water, pretty much after 20 seconds, or with Clorox, or with Purell, or with any of these cleaning things. So I think keeping your hands clean, never touching your face, getting cognizant of that. And one of the reasons why it's good to wear a mask is because if you have a mask on, you won't be touching your nose or your mouth. You can't. And so the mask really helps you avoid, contaminating yourself until you, decontaminate yourself when you get home. So to answer the question, though, let's say you have to work. We have sort of divided loosely the kinds of people who are more at risk for being sick if they got this. Everybody's at risk for getting it, but who would really struggle with it? So I think if you have hypertrophic cardiomyopathy and you're in what we call class 3 or 4 heart failure, so these are people who get short of breath climbing a flight of stairs or walking a block. They get short of breath with that. They may have swelling in their legs already. They may get lightheaded. These patients, this category of HCM patients, if they get COVID, they would probably be sicker only because the heart, as you mentioned in the previous segment, has to work harder with any infection. And when that heart has to work harder, we already know that HCM hearts, depending on how debilitated they are, may not be able to meet the demands of your body. So if the lungs are struggling and the heart has to get blood to the lungs and around the body, and then that struggles too, well, then you have 2 organs that are in jeopardy. And once you have 2, then like a domino effect, things can go down. We don't want to scare people, but definitely if we've been telling you have class 3 or 4 heart failure in the office, and I think most of us call this New York Heart Association class 3 or 4, or functional class 3 or 4, or to make it easy for you guys, if those of you who've done treadmills, if you haven't been able to go more than 6 minutes or so, I think less than 6 minutes is probably a gauge of where you probably struggle a little bit if you had. It doesn't mean you're going to die. We have we know how to handle these things, and it's nothing new to this disease and any other disease. It's just supportive care and taking care of your heart and lungs if this happens. But we would recommend that those people who are class 3 and 4 really do a good job of staying away. That means that if you're class 3 or 4, you really should be at home. And if you go out, you wear a mask and you wash your hands. And then remember, we all want our family to come visit, or we want to go visit people, but remember that nobody knows who has this. And there are estimates that 1 in 5 people in New York are carrying this right now based on testing. I don't know if that's true, but if that's the case, then that means that a lot of people that you see at the grocery store have it and don't know it because they're asymptomatic. So you need to wear a mask all the time if you're class 3 or 4. That's my advice.
You even, regardless of 3 or 4 class, if you're in the home with somebody who you're not sure is clear of the virus, you need to have social distancing in the house.
Right.
I have not touched my husband in 11 days because he flew and he came home a week ago Thursday, and he is sequestered to a different bedroom. He is not using the same, we're not using the same bathroom at this point. Anytime anybody touches anything in the kitchen, it has to be washed down. Um, we Lysol the entire house every morning, just to make sure that he's not an asymptomatic carrier.
Right.
And so far, so good. Thursday will be 2 weeks. So then I think we can.
Yeah, I think we know that after that, this takes about the average time to symptoms is 5 days. So that means that people could be exposed to somebody and be completely normal for 5 days or so until they start having fevers. And many people don't have fevers. But you're right. If you can wait 2 weeks, generally speaking, if the person's good during that whole time, then they're good. People can have to make their decision about how extreme they want to be at home with their loved ones. Lisa's a transplant patient, so it might be a little bit different. But I think social distancing does help here. Obviously, if you've been with the same person and you know what they've been doing for all this time and who they've been seeing all this time, then you're fine with just staying with that one person because you have the same exposures as that one person. But if that's not the case, then you have to be careful. Like I have a son, and when he goes, and I'm divorced, so he goes back and forth, I have to make sure that my ex is also healthy and there's nothing new going on over there because he's coming back, and I have to know that we can do all of our non-social distancing that we do.
So let's go back to the question about healthcare workers with HCM.
Right.
Sal he works in an OR. Rebecca, she is a healthcare assistant. And then I have somebody else who lives with the first responders. So those are kind of separate questions.
So I think if you're working in a hospital, you should ask your hospital what their policy is. Some hospitals are saying that if you're particularly susceptible to getting a sick form of this disease or a severe form of the disease, they will keep you in areas that are less likely to catch it, or at home, for example. So if you're over the age of 60, 65, or if you have a cardiovascular or the things are heart failure, hypertension, and diabetes, those are the main risk factors for having a more severe course of this illness. If you have those diseases, and hypertrophic cardiomyopathy, as you know, can be a form of congestive heart failure. Those would be you would be the type of patient that you'd want to take extra precaution. And I would tell your employer that you have this disease and you're concerned about it being worse in your case, and what are the options. Now, obviously, from there, you have to then decide what to do. But I think most hospitals have been very careful about protecting those individuals. Some hospitals are keeping older people at home. And there's lots of ways to work from home. I think one of the best things that's happened is hospitals have realized that one of the best, easiest ways to protect your staff, so you have staff when the tsunami of patients with COVID come in, is to keep a lot of staff at home or away from clinical areas, but home meaning in isolation, so that they don't get sick and they're available. We're doing that with doctors too. We're trying to stagger our doctors, so some of them are at home, half of them are at home, half of them are in the hospital, because the caseload right now is light if we have no office hours and elective procedures. So they're really protecting them as a resource so that they're available to come in when needed for all of our patients. So I think patients should do the same thing. If those of you who work in the hospital setting, you should ask them. They may be able to keep you home, working from home, or working in areas that are fully protected, or they can stock you up with the kinds of personal protective equipment that will prevent you from getting this more than other people. So lots of options.
So the next part of this is, so let's just wrap that one up in a little neater package. Speak to your individual healthcare provider if you're working in healthcare.
Right.
Get some input from them. If they strongly feel you should not be frontline, they may need to write in a note or a letter to your employer to let them know what the clinical reasons are. Right. And look for an ADA accommodation of a reasonable accommodation to do other type of work during this crisis.
Right. Now, also, I think this gets a little technical, but some of the data coming out, the reason why heart failure is a big risk factor is because a lot of those patients were on ACE inhibitors or ARBs. I know, Lisa, you understand this, things like losartan and lisinopril. One of the beauties of our field is that the vast majority of patients are not on those medications because they make the obstructive physiology worse. So that's one of the first things we get rid of in our patients. So it is possible that our HCM patients may not be as at risk as other people they may be more like a normal person risk as opposed to hypertension, diabetes, or heart failure, because those three diseases all have a common theme that they use those medications, and it's possible that it's because those medications, which are great medications, have been used in those three subsets of the population. Those three subsets are at much more risk right now because it seems like the virus gets in because of the receptor that that drug uses, and our patients usually don't have that medication. Some of our patients do if they're non-obstructive apical variants with severe hypertension. They may be on those medications. So I would ask your doctors, if you're on those medications, what to do about that.
So what would we recommend for people who have loved ones who are first responders that could be going out and being in touch with God only knows what?
Right. That's a great question. So there's a lot of articles online about this. It's scary because, as I just mentioned before, you're living with somebody and then they go out, they work, they come back. You can control your environment, but that's part of your environment. So how do you make sure that part is safe? So that person should be should protect themselves when they're out. So if they're first responder, they will be wearing a mask. They'll be wearing gloves. So in some respects, they're actually safer than the pizza guy coming over, right? Because the pizza guy maybe not doing that stuff and not caring, thinking they're asymptomatic. But the healthcare first responder will be very careful. They've lived their whole life trying to avoid illness to bring home, so they know how to do this. So they'll be wearing a mask, they'll be wearing gloves, and then when they come home, what they should do basically is take everything off, take a shower, put everything in the wash, and then they can give you a hug and a kiss. Before that, they really shouldn't, because it can live on their hair, it can live on their face, on their skin. If they're coming home, they don't want to infect anything else in the room. I know we're getting a little extreme, and we don't really know if it's going to do all those things. But I think better safe than sorry. So when they come home, they change, they shower, and then it's not a bad practice anyway, to be honest, after going to the hospital and coming back or wherever they work.
It's not. So my husband.
If they do that, I think they're safe, and they're completely safe to be in your environment. Definitely.
My husband and my daughter, the rule is in the house, because there's the three of us living here right now. They come in, they immediately go into the bathroom, they shower, they put their clothes immediately in the laundry. I'm doing a lot of laundry, lots of laundry going on. But you just get it done and you don't let it sit around, and you don't throw dirty clothes from one place to another immediately into the laundry. No dropping it on the floor to the kids who might be outside and ran into somebody or whatever. But it has to go, that's how clean you have to be. And then you have to remember to go back and wipe down the door handles that you just came in, clean the banister that you may or may not have touched because you don't remember.
Right.
The little things. My experience as a transplant patient and a germaphobe are serving you now.
Yeah, the germaphobes rule the world. Germaphobes and introverts rule the world right now.
Exactly. Monk was really kind of a rational guy when you think about it in today's world. Okay, so I did want to talk about another very key issue, and that is how important mental health is during this, and how do we keep mentally healthy?
Right.
What do you think?
So this is tough all year round for everybody. So mental health is important. People have jobs, families, stress, and their illness, right? And so how to handle all those things. And anxiety is a big component of living with chronic illnesses, and certainly our patients are not immune to that and have anxiety. So right now, anxiety is through the roof because people are worried about this invisible threat, as President Trump calls it, which is true, that's out there, and it can infect you, and it can be very disastrous. I know you roll your eyes. It's okay.
No, I'm hugging my Clorox.
I'm going to keep it apolitical because I'm on your side anyway. But so there's the invisible threat, and that is scary people. Not to mention, we spent the last 10 years with pandemic movies and zombie apocalypses all over. Everyone's thinking that this virus is going to cause people to convulse on the floor and come eat them or bite them. So we've been worried about that for a long time. And this is the hidden, not that's what's going to happen, but the hidden fear about pandemics that it could wipe off the planet type of thing. So there's a lot of anxiety. That's not going to happen here. We already know that the death rate is very, very low. It is a lot if you add up the number of people. So that's why people are concerned. It is a lot of people in the world, but it's not a lot of people. It's not like you're going to lose your next door neighbor necessarily like that. So people need to be understanding that it's something that we're going to handle. I mean, medicine has been handling this for many, many years. The last time we had one like this was about 100 years ago, 102 years ago, actually. and the Spanish flu in 1918. And we didn't have all these medications or these brilliant scientists and labs and pharmaceutical companies that can move very fast. So we're actually in a good time right now. It does mean it's going to be handled in a year, which is, pretty good considering that we really didn't have any way to handle it back in the day. So the first thing is for people to put things in perspective like that. And the fears about the food shortages and the toilet paper shortages, all that stuff is not real fear because those things are going to be able to be manufactured. But there are ways to cope with anxiety. So in general, people cope with anxiety by having routines. Routine is a great one. And then having outlets for that anxiety. So outlets could be social interaction, which has to change. So maybe social interaction becomes things online. People will hang out with people with a glass of wine or whatever they want to do on the computer with 3 or 4 people. So I'll just tell you as an aside, I don't know if any of them are on the call here, but we had an HCM team meeting over the weekend by Facebook Messenger, and I had all 4 of them on the screen: Mallory, Nicole, Carolyn, and me, and it was great. We had a little group discussion FaceTime, and it's actually a lot of fun because you're actually hanging out with 3 people that the only other way we would do that would be to have them come over, and it's just as much fun, to be honest. So I think people have to get that interaction, that's how you're going to talk to your parents or your kids, so you don't infect them or they infect you, but rather you still get that social interaction. So that's very, very key. The lack of social intimacy interaction is going to lead to a lot of depression and anxiety if you don't have it. So we need to keep that up. Then you want to find other things, hobbies or ways to pass the time apart from the work you might do from home, and that'll involve things that make you happy. Everybody has to find things that distract them. So that could be exercising at home, that could be reading at home, that could be watching Netflix or movies at home, that could be doing puzzles, things that we used to do back in the day, like games, board games, stuff like that. Reinvestigate the things that can make you happy in an age where the other things didn't exist, right? And so they're there. I'm sure you have passions that you didn't understand or know about. Some people like coloring books and stuff like that. They've all come back. And they've come back because people need a way to center themselves and focus on things other than the anxiety of what's going on in the world. So those are things I would recommend. So no question, we talked about diet and about fitness. I do recommend that.
Wait, I have to show something off, Hari.
Oh my God.
This was my transplant meditation. Okay. Wait. I didn't plan this. It happened to be sitting here. So this was a gift from my aunt. And I spent my time, I'll find 1 or 2 in here that I actually did. It's a very big book. Oh, there's one. Look, I could color like a real good girl. But it is very meditating. You just color.
And they distract you from eating and doing all the other stuff. So I think you need to relax your mind. So these things relax your mind and also help you sleep better at night because you've defocused on all the anxiety and you sleep better. People have poor sleep because they're anxious oftentimes. So you need to do something like this. And then the fitness thing is important. This is I would turn around and say, this is the time that you have now to get yourself a routine for exercise. And you have to be creative. So I used to go to the gym 3 or 4 days a week. I can't go to the gym right now. So I'm in a walk up. So I walked up 5 flights 5 times. That's not so easy. So I find ways that's something new and you make it interesting. I have a little home gym. It's not the same as my gym at the fitness place, but I try to do routines like people in the Army would do, where they don't have all these things. Push-ups, sit-ups, squats, lunges, whatever you can do. Now, I'm not trying to say that everybody with HCM can do these things. Your fitness level, but everybody can do a little bit incrementally more than they've been normally doing, and keeping in mind that they're not out walking around, so they have to do something, otherwise they will definitely gain weight, even if they ate the same amount. So, at least now, if you're home all the time, I would say every day you should do some activity. Of these things that I mentioned, we can certainly talk offline a little more about the different things that might work for you. It's going to be very specific to what your fitness level is right now.
I'm multitasking here because I know that there is a resource that we have online. It's actually a fitness app or website, I should say, for patients with HCM, created by Harry Rakowski out of Toronto. So where did it go?
And also on your iPhones, if you guys have iPhones or other smartphones, it usually tells you how many steps you've been doing. Go back and look the month before this started, how many steps and how many flights equivalents you were doing every day. Find a way to do the same amount at home, because otherwise that's all energy that you haven't expended, and it'll go into other places of your body. And so we're lucky that we have that information, and we can then make sure that we're at least getting close to that. And if you are not that close to it, you need to minimize how much you're eating compared to what you've been eating the month prior to that. And that's not as easy.
So that is very true. I'm going to tell you a couple of the cool things I've done for my own mental health during this bizarreness that is a pandemic. You don't want to travel too far from home because you want to keep that social distancing. And I don't want to even have to need my car. Like if my car broke down, I don't want anybody to have to come get me. So I've either found places to walk that I've never walked in my own neighborhood. I always would go down and around the lake. Well, I went the other way. It's a dead end road and it's beautiful. So I get a 2-mile walk if I do that. That's nice. There's parks up and down my road within a 2-mile radius. And I've gone to parks that I've never gone to before.
Right.
And I've done a lot of walking. I actually went to, there's a place by me called Graffiti Rock. There's like an American flag painted on the rocks and you drive by it. I never knew how to get there. I've lived here my whole life. I found the path.
Yeah.
It was 71 stories that I ended up doing during that hike.
Yeah. Wow.
That was Sunday. My legs still hurt. Could not do that pre-transplant. That's true.
Right.
But there are flatter paths that you can do. And my other favorite thing I did that got me out of my own head for a while, I belong to Masterclass. I don't know if anybody has seen that app, but you can get lessons from the masters no matter what the category. I took a course with Malcolm Gladwell on writing, but last week I took a really long walk and I listened to Neil deGrasse Tyson explain how he thinks. It was fascinating. And Neil, if you're watching this, dude, I'm buying you a drink sometime because I got to pick your brain more because I love your brain. So it was awesome. But it's if you're reading or you're listening to story, Audibles is offering books,
TED Talks, lots of things you can do.
They're all going to help you mentally process all this better.
The other thing that Lisa just mentioned is that I concentrate on what you can do at home, but the truth is you can go out. Just try to stay away from people. Wear your mask until you get to, if you can drive and you get to a lake where there's not that many people, you're totally fine there. This virus is only coming out of people. It's not kind of hanging around lakes like that. So you can go to places that are fairly isolated or more remote and be yourself. Have a picnic. Weather's getting better in most parts of the country. Run around the lake, walk around, and get your exercise that way. This is not a situation where you have to stay at home. It's just I'm in Manhattan. So in Manhattan, it's hard to stay isolated unless you stay at home. But other places, you can get out and just stay away from people and enjoy nature, enjoy spring. That's all still happening. And let life go on.
Spring? They canceled everything else.
They did not cancel spring.
I'm sorry, I'm getting slap happy. So it's 4:00 in the afternoon, and that means for my pandemic schedule, as long as it's not raining, it's time for me that I can go take a walk. So I work up all day to my 4:00. I go for a walk for an hour, hour and a half, come back and do another about hour or so of work, and then I get to watch a TV show. But I don't turn the TV on all day, or I would sit there all day.
Yeah, guys, don't just sit there and watch CNN or news all day and count the numbers of cases and that stuff. It's just going to cause more anxiety. So just go out and live your life still. Remember these things about diet, mental, peace of mind, how to be socially interactive without the ability to actually see people as much. And remember, we're all here for you. So our team, and I'm sure all the other HCM centers, we understand it. We get it. I have most of my team at home, but they're answering the calls. You wouldn't know the difference. And so I want to keep everybody safe that way too.
So Gwen put up a great comment here is reach out and connect with another patient. Yeah. If you're on the HCMA Facebook page, which you are right now, if you go up to the top, there's a little tab that says groups. And there's 2 groups that are associated with the HCMA. And they're moderated groups. We have a lot of people in there. I would encourage you all to join the general chat group or private group. We do have one for parents. It gets a little bit more specific for under 21-year-old children with HCM. So you can join those groups and you can stay engaged that way, make some new friends who understand your concerns in this unusual time, and we can talk together. I'm keeping the COVID conversation very, very moderated there. We're putting these videos out, so there's a lot of information here. So rather than people asking one-off questions, you can come in here and just listen to us while you're cleaning up your house or taking a walk, whatever, and just hear these messages over and over again to help remind you that you're not alone, that there's support here, that your HCMA specialty centers actually have a plan in place.
Yeah.
They can do video calls, they can take text messages, emails. They're there for you. You're not alone, and we've still got your back.
Yep. We're going to keep you out of the hospital.
Yeah. There's sick people in the hospital.
You don't want to be there. You don't want to be there. Yeah.
Absolutely. All right, Hari, thank you so much for your time this afternoon, and maybe we'll be doing this again in a couple of weeks. We'll see.
Sounds good. And if people have other ideas for Lisa, let her know. We'll get more people on these.
Yeah, so just to give everybody an update as to what's coming up, Thursday morning at 10 a.m. Eastern time, I will be with Dr. Jacopo Alivato, straight from Italy. He's in Florence, and he's going to share his experience through COVID, and we'll talk a little HCM with Dr. Alivato. And at 3:15 on Thursday, we're going to talk to Dr. Mark Sherrod about the speed bumps and the care of those with HCM. We're going to talk about, we get viruses. How do you deal with a virus? You have to have a colonoscopy, how to handle that. And all of those basic things that we don't spend a lot of time talking about because we like to just focus HCM. And then at 4:15, I'll be meeting with Dr. Marty Marin, and we'll just be doing a potpourri HCM. And then next Monday, we're going to bring you late breaking news about mavacamten study. And Tuesday, we're going to bring you late breaking news also from ACC on direct-to-consumer genetic testing versus specific genetic testing for HCM or other specific diseases, physicians' perceptions. So that was going to be an abstract at ACC, and you're going to hear it presented to you straight from Tom Callis from Invitae, who helped put together the data on that. So we're trying to keep you entertained, engaged, distracted,
That's right,
and most of all, educated.
That's right.
All
Thanks
right.
for having me, Lisa.
Thanks for being here, Hari. Take care.